Thank you, Dr. Stormer and Dr. Terrio. Surely, after those two presentations, somebody out there has a question. If you do, just raise your hand. Okay.
So if you go to medicaid.ohio.gov under research, everything that is publicly available is there right now.
Yes, use the mic.
Sorry. I apparently have problems with buttons today. I can't figure out how to turn this one on. If you go to medicaid.ohio.gov, there is a tab at the top for research, and then all of the published dashboards that are available for public consumption are there. Yep.
Good morning. My name is Steve Ringer from Christ Hospital. I had a question about is there anyone doing any research in the efficacy of multiple prescription drugs per client right now? So like you had said in one of your slides, so there's like 4.1 to 4.4 prescriptions per patient for there. Is there any understanding of any efficacy? And then if there is, are they even bouncing that against like pharmacogenomics data?
We are actually looking at, not necessarily, but we are looking at some of the prescriptions, what type of prescriptions are going to individuals, so we can help, number one, predict who is in trouble. We can tell what doctors they're getting their prescriptions from, to target the doctors for education and things like that.
I'm Jessica Bellamy, representing GRIDS and the Root Cause Research Center. And my question is, Judy, you had mentioned that social determinants of health is going to be a more part of the future work of Medicaid, and I was wondering if either of you could speak to that a little bit more.
Well, it's just trying to link different buckets of data together to get a better idea of what's going on with individuals and the barriers to different services. So one example is the Support Act, and is trying to link the Medicaid data to data from the Department for Community-Based Services. So that's the part of our state that has foster care, things like that in it.
Will you be looking at any other data sets or other organizations that have data that you can compile?
Oh, whatever we can get. But that's a big thing. And I mean, as you guys all know, part of clinical care is 20% of your health. Getting back to that World Health Organization quote. So if you're going to really make change and affect health in a positive way, you have to look at the other 80%.
Other questions? Someone's pointing. Great, thanks.
Hello, my name is Allison Humphrey. I'm from Louisville Metro Public Health and Wellness, and this question kind of piggybacks on addressing the social determinants of health. In a lot of other, before I'm just thinking of investments in housing. Some states have made investments in housing as a way to address the root causes of the health disparities in their communities. So I was just wondering, in the future, do you see healthcare moving in, I would say Medicaid in Kentucky, moving towards making investments like housing units or affordable housing to address those social determinants of health?
I don't really see Medicaid putting forth funds for that, but definitely partnering with other agencies to try and look into that.
There were some organizations in other cities that they partnered with other like local cities, and then they had to provide more affordable housing for folks to help reduce emergency ER visits.
Yes.
A lot of that things comes from having safe and healthy, fair housing. So
Oh,
I was
yes.
wondering if there were any plans on that. And
We do not have any actual plans on that right now. But it is, I'm sure, linking everything together, it's really going to, in order to improve health, things like that have to happen. It just has to.
We're ready for other questions, people.
Francisco Rademacher with the Health Collaborative. Talking about Medicaid actually hits home for me because I run the HEDIS report, or Medicaid reports for the Health Collaborative, and I can't count how many times we've asked about all these interagency, activities or data sharing and everything, and it always seems to come down to cost and the other term, transparency. So how do you break through the fear of, just for conversation's sake, alleviating the fears of Kentucky Medicaid or Ohio Medicaid sharing data freely, or any of the other MCOs, which I've been part of all those conversations of just freely sharing data and understanding that while there is a cost with it, the after effect is better health care. I mean, you have all these programs and they sound fantastic, but how did you break through that? How did you get these organizations to understand that letting people know how you do things, especially when your results are so great, isn't a bad thing? Even if there's a cost associated with it, what is the result is a healthier population.
Well, for Kentucky anyway, we've really just started. Our Office for Health Data Analytics has only been around a year and a half or so, and that's really what's pulling everybody together within the cabinet and within state government to be able to do some of these things, and so it's Kentucky data. I think before it just wasn't possible to do it, but now it is. We do try and to look at things from different MCOs and have focus studies, things like that, on different issues within the MCOs. And within the next couple of years, there's going to be a quality ranking system for all MCOs within each state that have kids or adults with Medicaid, and that's coming down the pike, and that's going to be, completely transparent. A lot of HEDIS measures are going to be part of that ranking, and people are working on that now at the national level. Yes.
So in Ohio, with the every single entity, every single agency has their own specific set of rules between federal, state, and then agency policies about what's going to be shared. And so with each legal team, there's sometimes some challenges in interpreting all of those rules consistently. One of the biggest helps in Ohio getting us to where we are right now is the lieutenant governor. So the governor issued an executive order that basically said within 30 days of being asked, you have to put all of your data out onto the IOP platform, which was Innovate Ohio platform, an initiative of the lieutenant governor, or explain exactly why you can't put it out there and what law is prohibiting you from putting it out there. With those two pieces in place, where there was a platform where data could be shared securely, where each agency could put their data out onto a common platform where it's completely walled off from all the other entities, and then for specific projects expose certain pieces of that data to be joined together in whatever fashion meets the security framework that's agreed upon for that project. So we just are wrapping up the first round of some opiate research projects. We have 3 going on right now. There are almost a dozen agencies that have contributed data to this project. It was this one was bid out. Deloitte was the organization that won the bid on that. So that particular data set is not available for all partners, but for specific initiatives relative to the state is there. Then from a partnerships with other universities. We just finished up again this with our first. It's called the Opportunity Index, Ohio Opportunity Index, where we've joined almost 24 different data sets from transportation, education, Medicaid, for multiple agencies together to create at the census tract level an opportunity index for how high or low any individual's access would be to necessary services from a social determinants of health perspective. And then the last piece I'll say to that is are you familiar with the TMSIS files that are being developed right now? So every single Medicaid state is being required to send data in a specifically structured format from CMS to CMS, which will then be available to other entities, not just Medicaid, but for anybody to be able to access. Now, it's not always free. What that exact structure is going to be, I can't say. I just know that Ohio is one of the first states that is where they've been rolling it out across the entire country. But so it's TMSIS. If you look for that over the next year or two, there will be more data for all Medicaid states becoming available for other partners to work with. And then, anyway, hopefully that answers that question. But there are ways of getting more of that to work together, although it's sometimes a multi-year process.
Good morning. My name is Jennifer Zimmerman, and I'm with BI3, which is a grant maker in health here in Cincinnati. And we fund a lot of community-based partnerships to address the social determinants of health. And part of our challenge is really to gather, analyze, and report impact of those programs on health outcomes. And my question is, have either of your departments done work in the past, or is there any opportunity to partner with local demonstration projects to demonstrate the impact of those programs to really make a difference in health outcomes?
I think it's through the state university partnerships. That's very doable. It's because it's using the expertise of the universities and what they are doing research on and partnering with them with our data.
And then from Ohio's perspective, there's kind of a balance. So we have the governor's priorities that we have to work, trying to take the majority of the resources that we have to be able to take care of the main initiatives that are set forth from a state perspective. We have various federal and state requirements from a statute perspective. But with the remaining resources, there's still time left in the day, but it's not an infinite amount of time. Within the quality improvement section of our department, we have the MedTap funds, which will fund about 2 to 3 dozen different projects that are done with community partnerships as demonstration projects across the state. Those can be applied for on an annual basis, and then they're awarded based on the possibility of those projects being population level health, right? So it's an individual project that's demonstrated in a community, but if it has the ability to scale up, those are the types of projects that will be selected. And we have a crew of statisticians as well as community our university partners that help to evaluate the effectiveness of the outcomes. And then part of that Medicaid eligibility and expenditures dashboard that I put up, part of it is to answer that specific question. So if you know that there's a particular type of service that you're wanting to address, one of the ones that I didn't show was on all of the different procedures or the different provider type. So let's say you're wanting to target, the 84, 95, behavioral mental health type providers. You would be able to go into that specific section. And then let's see a trend over time in this particular area. Am I seeing a bend in that curve in the way that do I want to see more services or fewer services in that particular area? So while we can't provide the same level of support for every single project and entity out there, we are trying to expose more data publicly, getting back to that transparency question, to help partners have the information that they need to be able to participate effectively.